This program is brought to you by Emory University.
In the society that we live in right now, there's a common and very deadly mental illness, and especially in our corporate sector. Do you know what that is? Irrational greed. Irrational greed. So you see that even from the banking sectors all the way to healthcare sectors are driven by profit. And the healthcare sectors especially, I think we're beginning to see some serious repercussions of that. We're spending over $2 trillion on healthcare, almost 50% more per person than next most costly nation. Yet for all this spending, more of our citizens are uninsured and quality of care is often lower, and we're not any healthier. Citizens in some countries spend substantially less, are doing actually better than we do. Make no mistake, the cost of healthcare is a threat to our economy. It is escalating burden on families and businesses. It's a ticking time bomb for federal budget. It is unsustainable for the United States of America. So basically, we're throwing money at the problem, and the problem is getting worse. Problem is getting worse and worse. When I was a consultant running around from East Coast to West Coast, North and South, I found out something very, very, very interesting, that there's a commonality to conventional medicine and integrative medicine. What's the commonality? Irrational greed, right? It's run by the system that wants to have integrative medicine. Oftentimes it's hospital. Hospitals only make money when you get sick and when you get admitted and they do procedure, right? So first of all, if integrative medicine is 100% successful in eliminating heart disease, would it be good for a hospital or bad for the hospital? It would be very bad for the hospital. So in the beginning, I thought, oh, these hospitals they don't know how to do this. They're not smart enough to do this. And then about a couple of years into it, oh my God, they are smart. Of course they're smart. What they want is a program that pretends that they care about you, right? Make you feel good, but actually don't make a big difference. So that's what I found out. So I said, okay, if that's the case, what I'm going to do is I'm going to do a simulation in my head, and what would I do differently? This is Dr. Weil and myself in Tucson, 2004, 10 years ago, and he said, imagine a world oriented toward healing rather than disease, whereas physicians believe in natural healing capacity of human beings and emphasize prevention over treatment. In such a world, doctors and patients would be partners working towards the same ends. And that is what motivated me. I wanted to be a partner with my patient rather than revolving door, just treat people and street them. That's what we would say. You treat and street, and you turf patients. What that means is that since you don't have a lot of time, you write a prescription, you write a test, you order X-ray, MRI, or you send them to a specialist. And then you bought yourself some time. And then the problem is that you do that, they're supposed to get better. They don't. And they come back, and it's like, oh, guess what? You sent me to orthopedic doctor, they did a procedure, now hurting more. What am I supposed to do? Or you send a patient with fibromyalgia. How many in the room know what fibromyalgia is? Have you heard of it? Okay, some people. Fibromyalgia is an illness where you have a lot of pain, but there is no evidence of inflammation in the body. So you send them to specialists in rheumatology, and those days they didn't believe in it. They said, oh, it's in your head. And that patient would come back crying, saying that rheumatologist said that nothing's wrong with me, that I really need a psychiatrist.